Well, hospitals across our region are fighting the surge in COVID-19 cases. We spoke with CHRISTUS Trinity Mother Frances to learn how they're taking lessons learned over the past year and a half and applying them to make for a better patient experience.
We don't want one patient to not get the care they need, no matter where they're from.
CHRISTUS Trinity Mother Frances spent the last year learning about COVID-19 and using those lessons to better treat patients. It's important since there are more COVID-19 patients in their hospitals and they're sicker than during the initial surge in January.
This fall, this surge that really hit us in August, our numbers are much higher. So the patients are also more critically ill, where nearly 45% of the patients in the hospital are requiring ventilators. And with that, both number surge and the surge in criticality of the patients,
the surge is leading the team to think up new ways to treat people.
It's caused us to look at multiple different areas of how we can improve both the care of the patient and the capacity of the hospital to deal with these increasing numbers and increased severity.
The changes include repurposing parts of their hospitals for COVID-19 patients.
We've done things like convert a waiting room into our post-anesthesial care unit so that we can take an area that was being used for post-anesthesia care and turn it into a COVID ICU.
We literally turned conference rooms and waiting rooms into patient care space in 48 hours.
It's an unprecedented crisis for East Texas and for CHRISTUS.
We had training in weapons of mass destruction and hurricanes and disaster events, but this is like a very slow-moving hurricane that we haven't really got hit by the eye wall yet.
CHRISTUS has been part of the East Texas community for a long time, and it's moments like this where they know it's all hands on deck.
This is our 84th year of being here, 1937. And the truth is our community has never needed us more than we have in the last 18 months or so. And that has dictated to us the need and necessity to figure things out.
Dr. Anderson told us that roughly 95% of the patients that are dying from COVID-19 at CHRISTUS are unvaccinated and recommended people get vaccinated, keep washing those hands thoroughly, and of course, stay home if they're sick.